Let's just show people what's happened to the
right,
numbers, because it's important to understand the context.
Yeah.
This is what has happened to waiting lists. We know, of course, the pandemic made things much more challenging, but our viewers can see it was going up well before the pandemic. Lots more money has gone in. There are many, many more staff. This is the situation that people like Lynn are having to deal with.
So if I may just try and explain some of this. So you're absolutely right to explain more money than ever before going into the NHS, and we have deployed that on trying to get more people into the NHS. So this week we met our manifesto promise that we would recruit a further 50,000 nurses into the NHS. That is great news that we've been able to
And there's still
achieve
tens
that.
of thousands of vacancies, but I'd like you to address
very
it,
much
because
so. But
this is the Prime Minister's target and it's going the wrong way.
In terms of waiting lists, so we have all these, the plans that we have in place to deal with urgent and emergency care, to deal with what is called electives, in other words, people that are coming in for non-emergency care. But we do have to acknowledge that the impact of the industrial action has really had an impact on waiting lists. So since December last year, we've seen some 1.1 million appointments have to be rescheduled. And so when I was appointed as Health Secretary, I wanted to try to address the industrial action with doctors, and I'm really pleased that in the last 3 weeks I've been in post, we have been able to reach a settlement with consultants, and I very much hope that consultants will vote for this when it's put to them, that will help to address some of that. But we are very clear that, you know, we want our doctors, our nurses to be able to work in the NHS, because that way we'll be able to not just deal with Lynn's case, but obviously help prepare for the future.
And of